The broadcast is now starting. All attendees are in listen-only mode.
Hi, this is Amber Cutler with the National Senior Citizens Law Center, and I am presenting today on the Coordinated Care Initiative Basics Preparing for Changes. We provided this presentation on March 13th in collaboration with the Disability Rights Education and Defense Fund. However, we had some technical difficulties with the presentation that day, and so I am re-recording the presentation for use now. The National Senior Citizens Law Center is a nonprofit organization, and we provide advocacy and education and outreach, particularly in the areas of public benefits, including Medicare and Medi-Cal and Social Security and SSI for low-income seniors. And here is the slide on the Disability Rights Education and Defense Fund. Sylvia Yee generally gives these presentations with me, but won't be joining on today's recording of the presentation. So I'm just going to jump into what is the Coordinated Care Initiative. And in a nutshell, the Coordinated Care Initiative is a new state program that changes the delivery of health care, including long-term services and sports, Medi-Cal and Medicare, for dual eligibles and seniors and persons with disabilities living in 8 California counties, set to begin no sooner than April 1st, 2014, aimed at coordinating care and reducing health care spending. And I'm going to go through each of those categories in more detail, but before I do that, I want to start with a glossary to make sure that we're all on the same page with regard to all of the different acronyms that are in the Coordinated Care Initiative. So the first is dual eligible. That is someone who has both Medicare and Medi-Cal, also known as a Medi-Medi. The other population impacted by the Coordinated Care Initiative are seniors and persons with disabilities, or SPDs. These are individuals who have Medi-Cal only, and the basis for their eligibility for Medi-Cal is based on either age or on disability. So dual eligibles and seniors and persons with disabilities, or Medi-Cal only beneficiaries, are the two populations that are impacted by the Coordinated Care Initiative. The other term I want to define is a dual special needs plan, or a DSNP. That is a special type of Medicare Advantage plan that is aimed at dual eligible beneficiaries. And then long-term services and supports, or LTSS. For most of you, LTSS is a pretty broad term that encompasses a lot of different services. But under the Coordinated Care Initiative, it has a very specific meaning. And it refers specifically to in-home supportive services, or IHSS, the Community-Based Adult Services, or CBAS, formerly known as Adult Day Health Care, the Multi-Purpose Senior Services Program, or MSSP, and Nursing Facility Care. So those 4 Medi-Cal benefits fall under that umbrella term of long-term services and supports. So when I'm referring to long-term services and supports in this presentation, I'm really talking about those 4 Medi-Cal programs. There is one slide I want everyone to pay a lot of attention to. It's this slide right here, explaining the 3 changes that are happening under the Coordinated Care Initiative. The first change is that everybody who has Medi-Cal, all Medi-Cal beneficiaries, are going to have to enroll in a Medi-Cal managed care plan. And this is different than how it used to be. Back in 2011, we saw individuals who had Medi-Cal only transition into managed care plans. This was mandatory for people who only had Medi-Cal. But there were large populations that were excluded from that transition. For example, if you were a dual eligible beneficiary, if you had both Medicare and Medi-Cal, you did not have to enroll in a managed care plan for your Medi-Cal. If you lived in a nursing facility, you did not have to enroll in a managed care plan for your Medi-Cal. If you had share of cost, you did not have to enroll into a Medi-Cal managed care plan. Under the CCI, this is changing. Almost all beneficiaries who have Medi-Cal are going to have to be in some sort of managed care plan for their Medi-Cal benefit. Very few exceptions to that. So that is change number 1. Everybody's going into managed care for their Medi-Cal benefit. The second change is that long-term services and support, so those 4 benefits I described just on the previous slide, are all going to become part of the benefit package that the managed care plan is responsible for. So back in 2011, when we saw seniors and persons with disabilities transition into managed care for their Medi-Cal plans, the managed care plan wasn't responsible for certain long-term services and supports. The managed care plans were not responsible for the nursing facility benefit. They're not responsible for IHSS. They were not responsible for MSSP. Back in 2012, they did become responsible for the CBAS benefit. So now all of those LTSS benefits, the Medi-Cal managed care plan is going to be responsible for. And that looks different depending on the type of long-term services and support we're talking about. So IHSS looks very different than nursing facility coming into the managed care plan. But to give an example, today you have a senior person with disability living out in the community, so they are already in a Medi-Cal managed care plan. They had to join in 2011. They go into the hospital and they're discharged to a nursing facility. Today, they would be disenrolled from their managed care plan for their Medi-Cal benefit and put in fee-for-service because they were put in a nursing facility or they were placed in a nursing facility. Under the CCI, that will no longer be the case. Instead, when they're discharged to the nursing facility, they stay in their managed care plan. But they have to go to a nursing facility that is within their managed care plan's network. So that's a major change to how an individual is receiving their long-term services and supports. Finally, the third change is the integration of Medicare and Medi-Cal into one managed care plan. So you can get both sets of benefits from one managed care plan. And this is called CalMedi Connect. And this is the part of the Coordinated Care Initiative we hear the most about. And that's because it's a huge change. We're seeing Medicare and Medi-Cal going into one managed care plan. This change is only impacting dual eligible beneficiaries. So those are the three changes happening under the Coordinated Care Initiative. So we're moving from a system that it looks like this slide. Basically, you have people who are in both the fee-for-service world and in the managed care world. So on the Medi-Cal side, there are a lot of people in managed care already because they had to go in 2011. But there are also a lot of people still in fee-for-service Medi-Cal. All of our duals are still mostly, for the most part, in fee-for-service. For the most part, long-term services and supports are being delivered through the fee-for-service system. We saw CBAS come in 2012, but IHSS and MSSP and nursing facility care are all being delivered through the fee-for-service system. And then on the Medicare side, most people are in fee-for-service Medicare. But there are some people who are in managed care for their Medicare side. Those are people who are in Medicare Advantage plans or in a dual special needs plan. So that's the system that we're moving from, and the system that we're moving to is one where all of those benefits and services are delivered through a managed care plan. And behavioral health has a little bitty star by it, and that's because the county behavioral health, the specialty mental health benefits that are currently delivered by the county and paid for by the county will continue to be the case. Those benefits will still be paid for and delivered through the county. So if we look at what we're moving from, it looks a little bit like this. Right now we have a senior or person with disability who is going to see any provider they want to see that accepts either their Medicare or Medi-Cal card. That provider then bills the Department of Healthcare Services or Medicare for that particular service. It's the fee-for-service system. So if someone goes to a provider to get an x-ray, that provider provides the x-ray and then bills the Department of Healthcare Services and Medicare for that particular service, for that x-ray. We're moving to the system where a senior or person with disability is a member of a health plan. That health plan contracts with the Department of Healthcare Services and Medicare and receives a rate, a certain amount of money to provide the services to the senior or person with disability. The health plan then contracts with a certain set of providers that become part of the health plan's network. And that senior or person with disability has to see the providers that are within the health plan's network. And we all know that sometimes when someone joins a managed care plan, there are certain providers that they are no longer able to see because they are not in the health plan's network. To emphasize again who is impacted by the Coordinated Care Initiative, keep in mind that it is only individuals who have both Medicare and Medi-Cal, our Medi-Medis, our dual eligibles, and then individuals who have Medi-Cal only, our seniors and persons with disabilities. Individuals who only have Medicare are not impacted by the Coordinated Care Initiative. Again, individuals who only have Medicare are not impacted. Individuals who are those with both Medicare and Medi-Cal, and individuals who only have Medi-Cal. But those different groups of duals and those seniors and persons with disabilities, SPDs with Medi-Cal only, are all affected differently. And I'm not going to go through a ton of examples and exclusions. It gets pretty far into the weeds. I do recommend that if someone wants to see if a particular population is excluded or how they fit into the CCI, they should refer to page 17 of our Advocates Guide, and the link to that is provided at the end of this presentation. But to give you a sense of how complicated the Coordinated Care Initiative, I'm going to go through each of these different bullets. So the first bullet are seniors and persons with disabilities who are already in a Medi-Cal managed care plan. For them, the change that they're going to see under the Coordinated Care Initiative is the addition of long-term services and supports to their benefit package, meaning that the managed care plan is going to be responsible for new benefits. So these individuals are going to get notices saying IHSS, MSSP, CBAS, and nursing facility care are all going to be new benefits under your managed care plan. There's nothing for these people, beneficiaries, to do, but they're going to get a notice letting them know that these new benefits are part of their Medi-Cal managed care benefit package. Then there are seniors or persons with disabilities who will remain exempt from being enrolled into Medi-Cal managed care. There are very few of these individuals. It's individuals who live in an ICFDD, intermediate care facility for the developmentally disabled, individuals who have other health insurance, individuals who live in a veterans home. Very, very few people are exempt from enrollment into a Medi-Cal managed care plan, but there are some. Then there are dual eligibles who will be passively enrolled into CalMedi Connect. And I'll explain passive enrollment in just a moment. But just know that most dual eligibles, those with both Medicare and Medi-Cal, are going to be subject to passive enrollment into CalMedi Connect. But there are groups of dual eligibles who won't be subject to passive enrollment, but who can still enroll in CalMedi Connect if they want to. So they're still eligible to participate in CalMedi Connect, but they're not going to be subject to passive enrollment. So individuals who fit into this category include people who are in a home and community-based service waiver, so our nursing facility acute hospital waiver, our IHO waiver. Those individuals, if they wanted to disenroll from their waiver, they could join a CalMedi Connect plan. But as long as they're in their waiver, they're not going to get any notices about CalMedi Connect. Similarly, individuals who are enrolled in Kaiser. Individuals enrolled in Kaiser, if they wanted to disenroll from Kaiser, they could do that and they could join a CalMedi Connect plan, but they're not going to get a notice about CalMedi Connect. Finally, there are dual eligibles who cannot enroll or participate in CalMedi Connect at all. So individuals who receive services through a regional center cannot participate in CalMedi Connect. Individuals who have end-stage renal disease cannot participate in CalMedi Connect. Keep in mind, though, that even though they can't participate in CalMedi Connect, they are still impacted by the Coordinated Care Initiative. They are still going to get notices telling them that they have to choose a Medi-Cal managed care plan. So even though they are excluded from CalMedi Connect, the CCI is still impacting them. In total, there's about 1.2 million people who are going to be impacted by the Coordinated Care Initiative in the 8 CCI counties. About 574,000 of those individuals are going to receive notices about CalMedi Connect. If you look at Los Angeles County, the number that can enroll in CalMedi Connect in Los Angeles County is capped at 200,000. However, only, despite that being capped, a total of 574,000 are still going to get notices about CalMedi Connect. So in Los Angeles County, all 288,000 people are going to get notices about CalMedi Connect, but only 200,000 can enroll. That second column are individuals who are going to get notices about their Medi-Cal managed care. Either they're individuals who have to choose a Medi-Cal managed care plan, or they are individuals who are already in a Medi-Cal managed care plan who are going to have long-term services and supports added to their benefit package. So that's an additional 632,000 people who are going to receive notices about their Medi-Cal managed care. So in total, we have 1.2 million people getting notices in the 8 CCI counties about the Coordinated Care Initiative. If we focus just on CalMedi Connect, keep in mind that CalMedi Connect, that program that combines both Medicare and Medi-Cal, is going to impact dual eligibles only. And most of those dual eligibles are going to be subject to passive enrollment into CalMedi Connect. So what does that mean? What is passive enrollment? So if we have a dual who's subject to passive enrollment, that dual is going to receive notices about the CalMeta Connect program. And when that dual receives those notices, they're going to have choices. So they can choose to participate in CalMeta Connect or opt in. If they decide that they want to participate in CalMeta Connect, they're going to have to choose a CalMeta Connect plan that combines their Medicare and Medi-Cal benefit. So for example, in San Bernardino County, they could pick between the Inland Empire Health Plan or Molina. If they choose, they'll make their choice of which CalMeta Connect plan they want, and that will be the end of their decision making. If someone decides they do not want to participate in CalMeta Connect, they quote-unquote opt out, they can stay in fee-for-service Medicare, or maybe they want to join a Medicare Advantage plan. But if they decide they don't want to participate in CalMeta Connect, they are still going to have to choose a Medi-Cal managed care plan. That is mandatory. If they're not already in a Medi-Cal managed care plan, they are going to have to choose one, even if they decide they do not want to participate in CalMeta Connect. Another choice that is going to be on the CalMeta Connect notices is the option to participate in the Program for All-Inclusive Care for the Elderly, or PACE. So someone decides, I don't want to participate in CalMeta Connect, but I kind of think this PACE option might be for me. Keep in mind that PACE has eligibility requirements. You have to be 55 or over, and you have to have nursing facility level of care needs. So this is really a program that's limited in eligibility. So not everybody can enroll in PACE, and PACE isn't available in all zip codes. And the PACE program, for those of you who are not familiar with it, like I said, there are the eligibility requirements, and it's very similar to CalMeta Connect in the sense that it combines someone's Medicare and Medi-Cal benefits into one health plan, into the PACE plan. But rather than seeing a group of providers that are out in the community all over the place, PACE provides its care at a PACE site. So you go to a center to receive all of your care. So that's going to be another option on the CalMeta Connect notice. So you can either decide to join CalMeta Connect, decide you don't want to participate in CalMeta Connect and choose a Medi-Cal managed care plan, or you can decide that you want to participate in PACE, and then the state will see if you're eligible for PACE. The passive enrollment process comes into play if you do nothing. If someone gets these notices about CalMeta Connect and they do not act, if they do not fill out their choice form, they do not call healthcare options to make a choice, they are automatically going to be enrolled into a CalMeta Connect plan selected by the state. So it's really important that people make a choice, because if they do not make a choice will be made for them. And we know that with transitions like this, having the choice made for you is not always the best option. It often leads to a disruption in care. So it's really important that people read their notices and make an affirmative choice. Keep in mind, though, that if someone accidentally does not pay attention to their notices and gets enrolled into a CalMeta Connect plan, or maybe they even decide they want to enroll in a CalMeta Connect plan, but then later decide that they don't want to be in one, you can disenroll from CalMeta Connect at any time for any reason. And the disenrollment becomes effective the first day of the next month. So it's a voluntary program. CalMeta Connect is voluntary. You don't have to join it, and you don't have to stay in it. But you do have to enroll in a Medi-Cal managed care plan. That is mandatory. So even if a dual eligible decides they don't want to participate in CalMeta Connect, or they decide later that they don't want to be a part of CalMeta Connect, or they're excluded from CalMeta Connect, they are still going to have to choose a Medi-Cal managed care plan. Being in a managed care plan on the Medi-Cal side is mandatory. Just a note about those individuals who are in a Medicare Advantage plan, or a DSNP. Those individuals are not going to be subject to passive enrollment into CalMeta Connect until 2015. So in 2014, duals who are in a DSNP and duals who are in a Medicare Advantage plan, they're not going to receive notices about CalMeta Connect. They may get notices about having to join a Medi-Cal managed care plan if their birthday falls in the first part of 2014, and then they're going to get notices about CalMeta Connect starting in October, about enrollment in January. But for 2014, they're not going to get CalMeta Connect. They're not going to be subject to passive enrollment. Passive enrollment for Medicare Advantage individuals will happen in 2015. So what kind of benefits does CalMeta Connect offer? What's this new health plan option really providing? So CalMedi Connect, like I said before, is combining someone's Medicare and Medi-Cal benefits into one managed care plan. So the CalMedi Connect plan has to offer all the benefits that Medicare and Medi-Cal currently pay for. So they have to have Medicare's Part A, hospital, Part B, outpatient, and Part D, the drug prescription plan. Keep in mind, though, that the CalMedi Connect plans can have different Part D formularies. So CalMedi Connect plan might have a different Part D formulary than someone had when they were in fee-for-service Medicare. So keep in mind that that's part of the CalMedi Connect benefit package. The CalMedi Connect plans are also responsible for delivering the Medi-Cal benefits. So they're responsible for delivering all those long-term services and supports, and any benefit that Medicare is not paying for that Medi-Cal would cover, for example, incontinence supplies. So long-term services and supports are covered, including IHSS, CVAS, nursing facility care, and MSSP. A note about the IHSS benefit coming into managed care, and this is true for CalMedi Connect plans, and it's also true for the Medi-Cal managed care plans if you decide you don't want to participate in CalMedi Connect. No matter what, you're going to have to be in a Medi-Cal managed care plan, and your LTSS is going to be part of that managed care plan, whether that's through CalMedi Connect or if it's just through your Medi-Cal managed care plan. IHSS won't look that different, at least for now, in managed care. The county is still responsible for assessing someone's hours. The county is still responsible for all the payment stuff and keeping the payroll issues. And the beneficiary still has the right to hire, fire, and supervise their IHSS provider. So technically, to the beneficiary, IHSS won't look that different coming into managed care, at least at the beginning. There could be changes later down the road. The other benefits that the CalMedi Connect plans are required to provide include vision and transportation. So with regard to the vision benefit, it is emergency restorative and preventative vision. And then there's a $100 copay, I think that's right, for a pair of eyeglasses every 2 years. So the vision benefit includes that. And then the transportation benefit has been described as a taxi voucher. But what the transportation benefit is, a transportation benefit that's above and beyond what Medicare and Medi-Cal already provide. So Medicare already provides for like emergency transportation, so ambulance. And Medi-Cal covers non-emergency medical transportation to like medical services. So if you need a paratransit vehicle, something like that, if you can't travel by standard forms of transportation like a bus or a private car, then Medi-Cal already pays for that. This new transportation benefit is that benefit for people so that they can take a taxi or take the bus or take have a friend drive them. It's supposed to allow people to go to medical appointments through those forms of transportation. So it's in addition to what Medicare and Medi-Cal are paying, and it's transportation to medical services by, most likely, by a taxi. So they would provide a taxi voucher. And finally, there's that care coordination benefit. That's the final benefit that the CalMedi Connect plans are required to provide. And that care coordination benefit is supposed to be the real meat of what CalMedi Connect plans are supposed to do. It's supposed to coordinate your Medicare and Medi-Cal benefits. So members are supposed to get health risk assessments that will identify their health care needs. If needed, they can have an interdisciplinary care team with a care plan. Those are the types of care coordination types of services that the CalMedi Connect plans are required to provide, including a care coordinator. In the middle column there, we have care plan options services, or what we call CPO services. These are benefits that are, I shouldn't call them benefits, they're not actually benefits. They're services that plans can provide at their discretion. They have no responsibility to provide these benefits. They are not required to provide these benefits. Technically, they could have a financial incentive to provide these benefits because the services, I keep saying benefits, I apologize, they're not truly benefits, to provide these services because these services could keep someone out of a nursing facility or out of a hospital, which would cost the health plan more than providing the actual services. So things we hear often that fall into this category are home accommodations. So maybe a shower bar or a wheelchair ramp. We've heard that some plans may offer additional personal care hours. They're required to provide IHSS, but there might be times where IHSS hasn't kicked in yet. Maybe you've applied for it, where the health plan might provide some additional personal care hours, those kinds of situations. Again, totally in the discretion of the health plan to provide these. Finally, in that third column are a set of benefits that the plan isn't actually being paid to provide, and the plan isn't responsible for providing. So that first bullet and second bullet are really talking about those mental health benefits that are provided for and paid for by the county. That will continue to be the case. The health plans are responsible for coordinating with the county. They have to enter into agreements with the county so that they can coordinate those benefits for the beneficiary. So it looks to the beneficiary that they're getting all of their health care, including their behavioral health through the county, through the health plan. The final bullet is the dental benefit. In May of 2014, adult dental is being restored to all Medi-Cal recipients across the state of California, so not just in the CCI counties, but across the state of California. That dental benefit is not part of the benefits that the plan is responsible to provide. The dental benefit will be delivered through Dent-A-Cal, and the health plans, though, have no responsibility of coordinating with Dent-A-Cal for that benefit. They may do so because it would make sense to do so, but they don't have to. So those are what we often refer to as carved out benefits, or benefits provided outside of the plan. If we switch gears and talk about where the Coordinated Care Initiative is going to start, it's in 8 counties: Alameda, Los Angeles, Orange, Riverside, San Bernardino, San Diego, San Mateo, and Santa Clara. And Orange, I'm going to talk about in just a second. In each county, there are different health plans, different CalMedi Connect plans available. And for the most part, these look very similar to the Medi-Cal managed care plans, but there are variations. So you can look at the CalDual's website to look at those variations, or also our Advocates Guide that's available on our website. It spells out the differences between the Medi-Cal managed care plans versus the CalMedi Connect plans. But as you can see, Alameda has a 2-plan model, so there are 2 health plans. Orange and San Mateo are called County Organized Health Systems, so they have 1 health plan, but you can see the different health plans listed here. San Diego is a geographic managed care model, so it has 4 health plans that are operating. Los Angeles recently had a change where it moved from a 2 health plan model, where it would be LA Care and HealthNet, to now there are going to be 5 CalMedi Connect plans in Los Angeles County: LA Care, HealthNet, CareMore, CareFirst, and Molina. Orange County has been delayed under the CCI. It had a Medicare audit back in the fall, which resulted in sanctions. And pursuant to those sanctions, CalOptima is not permitted to enroll new Medicare beneficiaries until Medicare says it's okay to do so. In response to the Medicare audit, the Department of Healthcare Services in California and the Department of Managed Care are also conducting an audit of CalOptima's Medi-Cal operations. So right now, the CCI in Orange County is on hold, and we don't know when that will no longer be the case. The timelines for implementation, so the when the CCI is going to occur, differs greatly. And the main factors dictating the timeline of the Coordinated Care Initiative are really the type of the county that the changes are happening in, the population, and the type of change that's happening. So are you a dual, or are you a Medi-Cal only SPD? Are you CalMedi Connect eligible? Are you already in Medi-Cal managed care? Are you in a Medicare Advantage plan, or have you been reassigned to a Part D plan in 2014? Are you an MSSP beneficiary? All of these different factors play a part in the timeline. And to give an example of the timeline, I'm just going to focus on Riverside, San Bernardino, and San Diego. And I'm focusing on these 3 counties because they currently are sending out notices for CalMedi Connect. And they are currently sending out notices for choosing a Medi-Cal managed care plan if you're ineligible for CalMedi Connect. So this is just an example of those 3 counties, but it gets very complicated very quickly. So if we focus on just a dual who's eligible for CalMedi Connect If you are a dual who's already in Medi-Cal managed care, you're going to be subject to passive enrollment on May 1st. If you are not in Medi-Cal managed care, you're going to go in by birth month, starting in May 1st. So if you have a birthday in May, or if you have a birthday in April, you're going to go in May 1st. And then it will go by birth month there and after. So if you have a birthday in June, then you'd be subject to passive enrollment into CalMediConnect in June. If you're an MSSP beneficiary, you'll be subject to passive enrollment in July. If we go down to the next column, if you're a dual and you're not eligible for CalMediConnect, or you're a dual who's in a Medicare Advantage plan, or you're in a Part D plan that you were reassigned to in 2014, if you fall into one of those populations, basically you're going to have to choose a Medi-Cal managed care plan if you're not already in one. Or if you're in one, your benefit's going to be added. So if we look at the 3 rows, if you're already in a Medi-Cal managed care plan, you're going to see LTSS added to your benefit package on April 1st. If you're not already enrolled in a Medi-Cal managed care plan, then you must choose a Medi-Cal plan. And that starts on May 1st for people who have birthdays in April and May. And then it goes by birth month there and after. So again, we're talking about people who are either ineligible for CalMediConnect, or they're in a Medicare Advantage plan or a Part D plan, and they won't be subject to passive enrollment into CalMediConnect until 2015. But they're still going to have to choose that Medi-Cal managed care plan. So that's the changes impacting them. Then if we look at the third population, if you're a Medi-Cal only beneficiary or you're a partial dual, meaning that you don't have full either Medi-Cal or Medicare benefits, you have a different timeline. If you're a Medi-Cal only beneficiary and you're already in managed care, you're going to have LTSS added to your benefit package on July 1st. If you're not already in Medi-Cal managed care, for example, maybe you're living in a nursing facility, you're going to have to choose a Medi-Cal managed care plan starting in July if your birthday's in July. If your birthday's in August, you'll have to have made a decision by August. If not, a Medi-Cal managed care plan will be chosen for you. And if you're an MSSP beneficiary, SPD, you're going to have a choice made by July 1st. So as you can see, it's very complicated, and these are just 3 counties, and it depends on a lot of different factors. I do encourage people to learn these timelines for their individual county and how each population is impacted and when they should expect notices. Anyone who has to choose a health plan is going to get 3 notices, a 90, 60, and 30-day notice about making that choice. If you have a July date of birth, you're going to get a notice in April, May, and then June, and then be enrolled in July. If you have passive enrollment you're subject to passive enrollment in January, you'll get a notice in October, November, December, and then you'll be enrolled on January 1st. The 90-day notice is basically an informational notice. The 60-day notice is a notice that already includes your default plan. So you'll get a notice saying, these are the changes that are happening, these are the choices you have. We've already selected a default plan. If you want a different plan, let us know. If you don't want to participate at all in CalMediConnect, this is what you need to do. In a separate mailing, but within the 60-day time frame, the individual is also supposed to get a guidebook that explains the changes that are happening in a lot more detail. And they're also supposed to get a choice booklet and choice form. And that's really where they make their choice. They fill out the form and they send it back to Healthcare Options, or they can call Healthcare Options and go through the form with them online to make their choice. The 30-day notice is a final reminder notice saying if you don't do anything, keep in mind that you're going to be enrolled on this day. So here is a sample of the 90-day notice. This is the CalMediConnect notice. As you can see, it's mostly informational. It gives you your choices, and then it directs people to contact the California Health Insurance Counseling and Advocacy Program, the HICAP, for help in determining if whether this is the right choice for you, and then it also provides Healthcare Options phone number. And this is the 60-day CalMediConnect notice. This notice is also accompanied by a FAQ, a short FAQ attached to the notice. And keep in mind that in a separate mailing will also come the guidebook and choice form along with the 60-day CalMediConnect notice. Here's a sample of the 90-day Medi-Cal Managed Care Notice. Again, this will go out to people who have to choose a Medi-Cal Managed Care Plan, and this notice is going to duals who have to make a Medi-Cal Managed Care Plan choice. And here is the 60-day Medi-Cal Managed Care Notice. And again, the 60-day Medi-Cal Managed Care Notice will also have a choice form and choice booklet that will come in a separate mailing so that people can make their Medi-Cal Managed Care choice. All of these notices are available on the CalDuals website under the Enrollment tab. And the notices have been translated, well, the 90 and 60 Cal MediConnect notice and the 90 Cal MediConnect MLTSS notice have been, they're available in English, and they also are available on CalDuals and all of the threshold languages. I think right now the 60-day Medi-Cal Managed Care notice is only in English on the website. So why are these changes happening? According to the Department of Healthcare Services, the goals of this Coordinated Care Initiative are to improve access to care and promote person-centered planning, independence in the community, providing the right care at the right time at the right place, and obviously cost savings for the state and federal government. But we're still just a part way through a long process. Even though we're at the cusp of everything starting, people are getting notices. Some people will be enrolled in April. Most people will start being enrolled in May. There's still a lot that hasn't been decided, a lot that's still going on. So for example, the exact enrollment strategy in Los Angeles County has not been finalized. All of the health plans are still working at developing their networks. And the health plans have all been assessed as being ready to accept enrollment, except in LA County where 3 of the health plans still aren't ready. But the building of their networks is an ongoing process, so contracting with providers is still going on. A lot of the policies and the directions to the health plans, the all plan letters to the health plans, still haven't been finalized. There's still a lot of questions about the underlying policies and the directives to the health plans. Not all of the notices have been finalized. There are a ton of notices once someone enrolls, or if they decide they don't want to participate in Cal MediConnect, what notice they get. The 30-day notices, there are just a ton of notices that have not been finalized yet. And then of the notices that have been finalized, a lot of them need a lot of improvements, and so the state is working to improve those notices. The independent ombudsman, that agency's been selected. That's going to be the Health Consumer Alliance. And how that will work is that the Health Consumer Alliance is the entity that will act as the independent ombudsman. And this program, the ombudsman, is to help people on the Cal MediConnect side with issues they have after they've been enrolled in a Cal MediConnect plan. So are they having problems getting benefits from their plan? Are they having enrollment issues after they came in, they want to get out? That's what the independent ombudsman is supposed to do. And like I said, the Health Consumer Alliance is the entity that received that funding, and how the different counties will have different legal aid organizations that will be providing the actual services. So for example, in LA County, it's Neighborhood Legal Services of Los Angeles. Down in San Diego, it's Legal Aid of San Diego that will be providing the ombudsman services. That all has to happen prior to April 1st, which is just around the corner. So there's just a lot to be done before the first enrollment. Keep in mind that the first county that will have people enrolled in a Cal MediConnect plan as of April 1st is just San Mateo. San Diego, Riverside, and San Bernardino will see enrollment in Cal MediConnect plans in May. Actually, Los Angeles County could also see enrollments on April 1st, effective April 1st, because LA Care and HealthNet can accept voluntary enrollments starting April 1st. But for the most part, things are kind of phasing in. We're seeing April, and then May, June, and then July is a huge month in which we'll see a lot of people enrolled and subject to passive enrollment. So the main question that comes up in this presentation is, should your client participate in Cal MediConnect? And I think it is such a beneficiary-specific question. It looks different to every beneficiary, which makes this whole that whole question really complicated. You just can't give the same advice to all beneficiaries. Each beneficiary has different factors to consider, and of the factors to consider, they weigh them all differently depending on their unique circumstances. So if we look at the factors that a beneficiary should consider in making that decision, I think the primary one is probably whether the CalMed Connect plan does the plan have their providers, that beneficiary's providers in its network. And of course, that just differs from person to person, which providers are most important to them. A lot of people, it could be their primary care physician. For some, it might be their specialist. Maybe it's both. For someone else, it might be their durable medical equipment provider. Not only do they need to look at all of their providers, they also need to consider whether their prescription drugs are covered on the CalMed Connect formulary. So that's another really important factor to consider in whether you want to join a CalMed Connect plan, and if so, which CalMed Connect plan do you want to join? Other factors could include, does your plan have strong relationships with social service providers, if that's important to you? If you're someone who's right in the middle of treatment, it's probably best that you just stay out of CalMed Connect and not deal with transitioning. That could be your individual situation. To some people, it might be really important to get those additional benefits in a CalMed Connect plan, like that vision and transportation. That could be, you might not care if your providers are in the network. You can find new providers that the health plan has, but you really want that vision and transportation benefit. Or maybe you really want that care coordination benefit. You want someone to sit down and look at your care, work with a care coordinator, and have a care plan team that is all helping you coordinate your care. So it just depends on the specific beneficiary, what's most important to them. Again, probably having the providers in network is the most important factor, but for some people that may not matter that much. So I strongly recommend that someone who's making this choice, they have to consider a lot. And so the agency that can help them do that are the HICAPs. And the HICAPs are in each of the counties, and there's a general number you can call that will direct you to the right county number, county office that could help with this kind of decision making. So what to watch out for that's good regarding CalMed Connect? I think the care coordination, one card, the additional required benefits of vision and transportation, maybe some possible benefits, possible care plan option services, and then the care coordination and assessments and care plans. Those are things that could be really, really beneficial to someone in a CalMed Connect plan. But there's also things that we should all be very cautious of. This is happening. The timing of this, the timelines themselves are confusing, the enrollment's confusing. The fact that it's happening at the same time that we see other healthcare changes happening under the Affordable Care Act, including the expansion of Medi-Cal, including Cover California, that's all very confusing for people. The wrong notices could go out to the wrong populations. We've seen that happen already. So there's just a lot of things happening all at once that can lead to a lot of confusion and mistakes. And then when someone's enrolled, losing access to their providers, which results in a disruption in care. So there's just a lot of things to keep your eye on to make sure that beneficiaries aren't negatively impacted by these different transitions that are happening. So what can you do? The program is still under development. Even though notices are going out and all this is still happening, it's still really important to get your input. It's important to attend stakeholder meetings. The state has stakeholder meetings. All of the health plans and all of the counties have stakeholder meetings. You can just reach out and talk to the plan. You can engage the legislative and do legislative advocacy. I think the main thing to do is prepare to provide counsel, whether that's learning a lot about the Coordinated Care Initiative or just learning where to refer people to if you know that someone is getting notices about this. And then it's really important to be ready to report problems. Report them to us, report them to DREDF, report them to the state, to Medicare. Just make sure you're telling people about the problems you're seeing on the ground so that they can be fixed rapidly. Oh, another major agency to report problems to is that independent ombudsman program. Because in addition to helping people with their individual issues with the health plans or with the CalMed Connect program, the independent ombudsman is also responsible for tracking those problems and identifying systemic issues. So in terms of who can help individuals, who can help individual beneficiaries, the HICAP can provide individual counseling and assistance. The Health Consumer Alliance, again, who will be acting as the independent ombudsman. Disability Rights California can help individuals who are having issues as well. Our information is available here. Like I said, our Advocates Guide is available online, and our website for that is dualsdemoadvocacy.org. And if you have any questions, do not hesitate to contact me and email me at acutler@nsclc.org. And thank you for listening into this presentation, and I hope it was useful.